Hello everyone, my name is Caitlin and my partner was Justice Cornejo. This is our presentation on medication management and polypharmacy in older adults. Today we will explain why medication management is a major issue for older adults, how occupational therapy addresses this problem, and why these services matter to payers and healthcare systems. What is occupational therapy? Occupational therapy helps people participate in meaningful daily activities in ways that support independence, safety, and health. Medication management is considered an instrumental activity of daily living, so it falls within occupational therapy practice. For older adults, occupational therapy helps develop routines and strategies that support safe medication use and continued independence. What is polypharmacy? Polypharmacy means taking multiple medications at the same time, often 5 or more, and it is common in older adults with chronic conditions. Although it may sometimes be medically necessary, it increases the risk of confusion, dosing errors, reduced adherence, adverse effects, and hospitalization. This is why safe medication management is such an important concern for older adults and systems responsible for their care. Medication management. Medication management involves much more than simply taking pills. It requires a person to understand instructions, follow schedules consistently, stay organized, and use memory, vision, problem solving, and physical skills throughout the day. Because this is such a complex daily task, even small declines in function can lead to medication errors and safety concerns. Factors that affect medication management. Many older adults experience age-related changes in cognition, vision, strength, and fine motor skills, and these changes can make medication routines harder and less safe. Medication management also depends on memory, attention, organization, and problem-solving skills. These barriers often show up in daily life at home and not just at the clinic, which is important because medication-related problems are a significant contributor to hospitalization among older adults. Benefits of occupational therapy. Occupational therapy provides several benefits for older adults managing medications and chronic conditions. Occupational therapy interventions can improve medication adherence, reduce medication errors, and increase safety in daily routines. Occupational therapy also supports greater independence in health management tasks and can contribute to improve functional outcomes and better quality of life for both older adults and their caregivers. Occupational therapy and chronic condition management. Older adults with chronic conditions often must manage complex routines that include medications, appointments, and symptom monitoring. Occupational therapy helps by addressing both physical and cognitive barriers that interfere with these routines. This support may also extend to caregivers, and it promotes long-term independence, safety, and participation in daily life. Occupational therapy intervention strategies. Occupational therapy interventions for medication management focuses on improving routines, simplifying schedules, and supporting independence. Practitioners may help older adults connect medications to daily habits, simplify complex medication schedules, and use support such as organizers, labels, and coloring coding. Occupational therapy also can teach compensatory memory strategies that make medication use safer and more manageable in real life. Occupational therapy interventions, evidence-based practice. So research supports the effectiveness of occupational therapy and medication management. Garrison and colleagues found that occupational therapy interventions and primary care improved medication adherence by addressing barriers such as forgetfulness, disorganization, and difficulty maintaining routines. Schwartz and colleagues also found that standardized medication management assessments did not closely match what people actually did at home, which suggests that real-world performance should be considered alongside clinical-based testing. Together, these findings support occupational therapy services that are individualized, functional, and grounded in home routines. Why third-party payers should support occupational therapy. This is especially important for third-party payers and regulatory bodies because of occupational therapy can improve adherence and help prevent avoidable complications. When older adults take medications correctly and consistently, there is a lower risk of hospitalization, emergency visits, and adverse drug events. Occupational therapy in a primary care has been linked to improve adherence outcomes, which supports better overall health management and more cost-effective care. In other words, supporting occupational therapy means addressing functional barriers early before they become more expensive medical crises. This is our references page. These are the sources that informed our presentation. Together, these references support the role of occupational therapy in improving medication management, safety, and independence for older adults. And then that will be it. To conclude, medication management is an essential daily occupation for older adults, but it becomes harder when physical, cognitive, and organizational barriers interfere with safe routines. Occupational therapy helps older adults manage medications more safely and independently, and for payers, that means better outcomes, fewer preventable complications, and stronger support for aging in place. Thank you.